everyone. Good evening. It is Traci coming to you live from Golden Dog Adventure Company headquarters. And I am here tonight with our partner, Dr. Lisa Boyer of Animal Health Consultants. How are you, Dr. Boyer?
I'm great. How are you?
Good. Thank you so much for joining us tonight. I know there's been some talk in our community about the respiratory disease that's circulating, some unknown information about it, some scares, some unknown stuff. And I just wanted to bring you on here with our audience, have them give them the opportunity to get questions answered. But I know you are up to date on all of this. And just as an FYI to people who have not met Dr. Boyer before, she is the veterinarian who does our Ask the Veterinarian series every month. She brings us amazing topics, all kinds of information, key resources, and expertise, and she definitely knows what she's talking about. So she is the number one person I go to with questions like this. So I wanted to bring her to our audience live. And who have you got there today with us?
This is Minnie.
Hi, Minnie.
That's Minnie.
Well, Dr. Boyer, I guess if you can tell us, let's start out with, what is this respiratory disease that we're seeing in dogs right now? Is it kennel cough? Is it something else? What are you and your colleagues seeing?
Well, kennel cough is one of those things that is not one specific disease pathogen. And by that, I mean, it sometimes will be one of a bunch of different viruses or bacteria. And for example, when you get a kennel cough vaccine, that's Bordetella, or if you get your DHPP vaccine for your dog, that's parainfluenza. And any one of those or combination of those can make up a respiratory disease. And kennel cough is an upper respiratory disease, and it causes that really seal-like cough that is very classic. It can cause a dog to cough hard enough that they vomit up some white foam. They can get nasal discharge, eye discharge, and feel pretty sick. And when it's caused by a virus, those are usually self-limiting diseases. And by that, I mean it goes away like the common cold on its own. When it's caused by bacteria, however, or it doesn't go away, it certainly can go down into the lungs and cause a pneumonia and become more serious. So even if it has a viral cause, we often will give antibiotics to help with maybe a secondary bacterial infection that might happen in combination. So it's in this situation, we are seeing a more serious disease lately, and we're not sure kind of where that's coming from. We have dogs that have been to dog shows, that have been to other high density dog events and venues, and those are animals that sometimes are coming down with a much more significant respiratory illness. And when we take swabs and try to test to see what that is, there's no consistency, but it's turning into a much more serious pneumonia, and in some cases has been fatal. And sometimes it's a hemorrhagic, meaning a bloody pneumonia, where the dog will cough and it's all of a sudden is coughing up blood. So it is something to be concerned about and not ignore. However, I don't think that we need to panic. I think there are definitely things we can do to prevent this from happening for your dog. I think that there are safety precautions you can take, but it all depends on the risk factors involved and where you go with your dog.
So, and we're hearing all kinds of different ideas about what this is. Like you mentioned, there is kennel cough going around. We're seeing it in the daycares. We're seeing it in the boarding facilities. Some people are concerned it might be coronavirus. Do you want to talk at all about the different tests at all that veterinarians do to kind of rule out some of these things that are worrying people?
Yeah, I mean, first of all, coronavirus in people is I think there's one or two cases ever that they've confirmed in a dog. It's not something we see. Coronavirus in a dog is generally a gastrointestinal disease that we used to vaccinate for it. We don't anymore. It really is not that serious a disease in dogs. It's a different corona than what people like COVID-19 has been. It's not the same coronavirus. So as far as I know, I have not heard anything that says that this is related to the coronavirus or any of the other human diseases that we've been seeing. I have heard that one of the tests we do is what's called a respiratory PCR, and those are swabs that are taken of kind of inside the eye and in the tonsils, the back of the throat, sometimes up the nose. We'll take a swab and we send that in for either a culture or what's called a PCR and those come back and we find out, maybe what pathogens we test for. I have seen mycoplasma, which is a bacteria that can be serious. That is sometimes what we're seeing, but there's no consistency right now, and the actual cause of this strain has not been identified. One thing, I think is that I know a lot of people don't vaccinate their dogs for DHPP every 3 years. They titer and check the distemper and the parvo. Well, when you do that, you're not covering your dog for parainfluenza. The dogs that are getting sick are vaccinated generally for kennel cough. Some of them are vaccinated for canine influenza. So that's different than a parainfluenza. So it's hard to know right now which it is. And not everybody is willing to do the test, because if you go into your vet and you think your dog has kennel cough and we ask to do the test, that test is like $300 or maybe more. And most people are like, no, just give them antibiotics, so we don't always know what it is.
So what would you advise dog owners right now if, their dog might have some discharge, might have a little bit of a cough? Should they worry and contact their local veterinarian right away? What's the best measure?
Yeah, I think first of all, if you have a dog that is coughing for any reason whatsoever, and that cough has gone on for more than 24 hours, you need to stay home and call your vet. Your vet may want to see you at the office, and that's fine. But before you walk into the office, you should call from the parking lot and say, hey, my dog may have a respiratory illness, and not walk through that vet clinic, because then the dog may contaminate, and cause an infection in other patients. So, if you think your dog has kennel cough or a cough for any reason, it does warrant a call and careful monitoring. They can take the dog's temperature as well. That can be done rectally or even under the armpit. The armpit ones aren't as accurate, but if your dog has a temperature above 103, that would be cause for concern. So if your dog's not eating or drinking or is lethargic along with that cough, that would be cause for concern. Nasal discharge, goopy eyes, all of those things, especially if they're lethargic or have a fever or just not eating or drinking, absolutely, they should call their veterinarian.
And I know some people have had a hard time getting into their veterinarian because veterinarians are so busy right now. Any advice you could give those folks there? Should they try calling another veterinarian? What should they do?
Well, number one, if their dog is coughing and is distressed, if they're not breathing well, if they're labored breathing in any way, you can look at your dog's belly and see if they're having a harder time getting air in. That does constitute more of an emergency. Okay, so then that would be the time to go to a local emergency clinic. Then there are some places that do urgent care hours. I know in Wyndham, Rockingham Emergency does an urgent care several days a week that you can get an appointment, so you're not waiting out in a parking lot for a long time. You can call them. There are other places that will do urgent care as well. So if you can't get into your vet, ask them where they're referring to, or start calling around and see who can see you. Or if you're really having a hard time, give me a call and try to contact me through email. And if I can make a connection for you, I will. I can't do that for, I can't tell another clinic what to do. But hopefully we can, try to get that person taken care of. The other thing is prevention right now. So if you're going to be out and about with your dog, I don't think you need to stay home, but I think you have to be smart. I would not share food or water dishes with another dog. I would not do toys with another dog, tug toys, balls, anything that is handled by the mouth. If you have a friend who has a dog and they're playing with their dog and then they want to go and pet your dog, no. If they have not cleaned their hands with sanitizer, they should not be, wash their hands. They should not be handling your dog. If you show dogs, you don't want a judge to go from dog to dog to dog. If you're on a walk with Golden Dog, a little bit of social distancing probably isn't a bad idea. Try to not let other people give your dogs treats, from their hand. So it's airborne, but it can live on clothing and on hands. And so we don't want to, go from one to the other. So I think it's safe in most cases to still go to things like some training classes, especially if they're outdoors or if it's an outdoor event. I think you're fine. Indoors, I think I would be a little bit cautious about boarding or doggy daycare. Those are the two that worry me a bit because there's not a lot of control. I mean, you go to doggy daycare, there's a pool out there, the dogs are in close proximity, they're playing, they're wrestling, the saliva, the air, everything is everywhere. There is a likelihood your dog will pick up something, even if it's not this, something else. Boarding would be the same concern I would have right now. I don't think I would board a dog. I'd get a house sitter coming in or a dog sitter coming in, if your travel plans are such that way, or but I think training classes where you can control the interaction with your dog are more safe, especially if they're disinfecting in that facility.
Yeah, and I think that's the key thing there. Don't be afraid to ask the questions about how they are keeping their facility safe. And we're still in the thick of people going on vacations right now, and I agree with Dr. Boyer that it would be a good choice to look at the possibility of having a pet sitter come into your house, but also what safety precautions are they taking between appointments. There's still lots of great boarding facilities out there and dog daycares that are potentially taking very good precautions. Again, ask those questions. I know that there are many of our partners as well, such as Sunwater Pet Resort, that have individual rooms for the dogs, and they can just be together and they don't have to be exposed to other dogs. So again, ask those questions and see what you may be able to book in that area.
Absolutely.
So, and like you said too, we would certainly shut down our events if you felt it was the safe thing to do, but we will be taking other precautions too. We will be more stringent about the water bowl sharing. We will also have cleaners with us so people can wipe their hands. If for some reason there's some sharing of treats going on, or we'll just tell people it's not a good idea altogether.
Yep.
But yeah, we want to make sure that everybody is safe. And please, 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 pay attention to the signs your dog is showing, so that if you are seeing anything out of the norm, make sure you're getting your questions answered before you take your dog out in public, potentially, because it could be the start of, what local veterinarians are seeing around here for this. So
yeah. And if your dog gets kennel cough, just the even run of the mill kennel cough, I would caution you, they need to be isolated. They're contagious about a week to 10 days beyond the last time they were coughing. Okay, and that doesn't mean coughing while they're on cough medicine. You're not coughing on cough medicine, like off of all medication and not coughing for about 7 to 10 days before I would even think about exposing another dog. So that is something to think about. And even if they're vaccinated for kennel cough or parainfluenza, I would really make sure, just to help everybody, not to expose another dog to your dog for about 10 days afterwards.
So we've got some questions here, Dr. Boyer. So Michelle brings up a good question. So her dog doesn't go to daycare, doesn't get boarded. I know her dogs do come to some of our events, but would you suggest the kennel cough regardless, even if there's not that wide exposure like some other dogs?
The kennel cough vaccine is only for Bordetella specifically. There's not a lot of cross protection with that. It doesn't last, super, super long. I don't think it would be harmful, but I don't know how much benefit there really would be, because this is not Bordetella. That most dogs are, the dogs that have been seriously ill, it is not typically Bordetella. It's dogs who are vaccinated are still getting this. And so, no, I don't think it's required. It would be one of those things I would insist on at this point. I don't want to vaccinate for things that we don't really know aren't an issue.
Okay, that's a good point. Another person asks, is this something that could be passed at a dog park? My dog doesn't go to daycare, but he loves playing with other dogs at the park.
Absolutely can be passed at the dog park. Yeah, that would be a place I would not go right now. I would stay away from dog parks until we know what's going on, until things settle down. Only because, again, no control. You don't know what the other dogs have. You don't know the vaccine histories. There's no sanitation really to speak of. They're sharing water. They jump in water sources. They're, close proximity. Yeah, I don't think I would want
and
to.
shared water bowls in most of those parks too.
Exactly.
And I don't think they get cleaned too often, unfortunately, because most of them are, just like volunteer run parks for the good of the community. So yeah, something to be aware of.
Yeah, I think I would stay out of dog parks till this has passed. Hopefully it will pass quickly. That would not be something I would want to risk personally.
Yeah, good point. Is this any different than a usual increase during the hotter months? Something different that has not been seen before?
Yes, I do think last year when I was here, we saw something similar last year. That was maybe mycoplasma. This year, again, the pathogen hasn't been identified. I do think this is different. It's not your run-of-the-mill kennel cough, upper respiratory disease. It is more of a serious pneumonia that results, and in some cases has been fatal. So I do think that And it's been very rapid. Like the dog would come in maybe with a little difficulty breathing. We'd get them started, what we normally would do, supportive care, and within 24 hours they're gone. I mean, it's rapid. So this is not the typical presentation that we see.
Do you think that the summer months are exacerbating the condition or the disease?
I think more people are out with their dogs. There's
Yeah,
more
that's true.
exposure.
More in crowds and stuff.
Yeah, I don't know that
But it's not the temperature per se.
no, I don't think
Okay.
so. I don't
Okay.
think so. It's hard to know. We don't know what it is.
Yeah. This person has asked, my dog is receiving chemo treatments. Is she more vulnerable to this? She does go to daycare on occasion, but should we keep her out?
Yes, yes. Chemo is immunosuppressive. Will make you more it will make anybody more vulnerable to any kind of pathogen. And if at this time, at least for the next few weeks until we know a little more, hopefully we'll find more, or this passes, I would not have your dog at any boarding, grooming, or doggy daycare.
Okay. Daniel asks, I just lost my animal from a respiratory fungal infection. How do we protect for fungal respiratory infection? It's awful. Sorry to hear that, Daniel.
And I'm so sorry to hear that. I don't know that you can unless you are able to know the environment and where they picked it up and why your dog might have been more susceptible. I mean, if you were in an area that like aspergillosis or some of the other fungal infections is prevalent, just trying to stay out of those areas where we know it happens. I don't know any specific thing other than keeping your dog healthy and good immune system. I mean, we don't want a dog to be housebound. I mean, that's not a good thing either. Dogs need to have quality of life and they like to explore their environment and have that mental and physical stimulation. Fungal is from the soil generally and from no natural sources, not dog to dog. And so it's just one of those things that, sorry, Augie's deciding to be in this chair right now.
Augie and Minnie show.
Anyway, so, I don't know that there's a lot you can do, Daniel, unfortunately. And I'm just so sorry for that.
Yeah, as am I, Daniel. Dawn is going on vacation and she is trying to work with her boarder or get a pet sitter. But one of the things she says here to boost immune system, should she give echinacea? Is that something you'd recommend or any other immune boosters you can think of?
If your dog is normally healthy and is on a good diet and gets good exercise and doesn't have any concurrent illnesses, I don't know that echinacea is going to really help. Vitamin C certainly is always anti-inflammatory and antioxidant. A little bit of vitamin C isn't going to hurt, but generally, I can't really say that I would say echinacea in particular. I think if you're going to board your dogs and you have a private play area and they're not in the general population, you're probably fine, as long as their air handling systems are appropriate and filtered. But again, it's just that how is that going to be handled? And is the staff going to be washing their hands in between handling other population of dogs and your dogs? I mean, that would be the main thing. I would want to make sure that your dog was not being exposed via the employee to anything.
Very good point.
Yeah.
Tracy is wondering, would sniff spots be off limits too, or can that kind of be managed if you're not drinking from the shared water bowls there?
If you guys are generally the only dog at a sniff spots, and I would say as long as you're not using any of their toys, you can use as long as they're not putting their mouth down onto places other dogs have had their mouth. So equipment like agility equipment or something where isn't disinfected. I think sniff spots would be fine, but I would not use any shared water sources for sure.
Yeah, I would agree. So I guess, to summarize here, that the best things that I'm hearing are, be diligent, obviously, be very aware of what your dog is doing, how your dog is feeling, and ask the hard questions of doggy daycare, of your pet sitters, of your boarding facilities. Make sure that they are aware of what is going on and what processes, procedures, safety, processes are they putting in place to ensure your dog's safety over and above what they would normally do. And, you may need to change your plans slightly. You may need to patch together a combination of things. You may need to do a little bit of quarantining just to keep yourself safe, your dog safe, until we have a better understanding of what this is. And I know Dr. Boyer will be dedicated to making sure we have all the updated information. As she finds out, she's very well connected in the local and extended network beyond New Hampshire. So hopefully we can tap you in the future as well as you have
Sure.
more information and go live to our audience here. So
Yeah, no, that's great. And I think, like I said, I wouldn't be worried about participating in the Golden Dog outings right now. I think everybody can bring their own water. You can do a little bit of social distancing where the dogs aren't nose to nose. I think you're fine in the outside. I don't want people to worry that and realize it's not like every dog is getting this. I mean, it's still a small number of dogs, but the fact is it's an increase over what we normally see with kennel cough, and more in particular, it's a more serious situation. It's not the typical run of the mill. And the incubation period can be 10 days. Your dog, like kennel cough, usually is about a 10 day to 2 week incubation. So you go to the groomer, and somewhere within the next 14 days, your dog gets sick. So realize that you need to be on the lookout for a week or two beyond that exposure. So if you took your dog to the groomer, keep an eye out for 2 weeks. And if that dog is coughing or is lethargic, not eating, not drinking, has a fever or anything like that, then your antenna should go up. Hey, something's not right.
absolutely. So guys, if you have additional questions too, or you're watching this on the replay, reach out to us at woof, WOOF at goldendognh.com. You can also consult with Dr. Boyer here directly. Her information is on the ticker at the bottom of this screen. You can also post in our communities if you have any questions as well. You might be able to tag Dr. Boyer. You can also tag me. And we'll accumulate these questions. And as we get more information, again, we will come back to you live. You can also check our website blog for updates. And you can also stay updated through our Facebook page, Golden Dog NH. And we will, stay dedicated to making sure you have all the updated and correct information. Please don't go to all these different sources and try to piece together this information. Get it directly from the source, which is the veterinarians, your local veterinarian, Dr. Boyer, or another expert professional such as that. So thank you again, Dr. Boyer, for your time. Thank you, everybody, for your questions. Guys, stay diligent, but don't worry too much. We're going to get through this, and we'll make sure you guys have the correct updated information. All right, everyone, have a good evening.
Have a good night.